Okay, Assalamualaikum and a very good day. And as a representative for the second group for the ADS503, the knowledge management, we are having the case study for a case in a medical record department, HWKKS, where we're gonna analyzing about the organizational intellectual capital and its effectiveness. So after this, Miss Irene will do the introduction about the case study in medical record department, HWKKS.
Hi, my name is Aaron Samuel, and our group will present the analyzing organizational intellectual capital and its effectiveness, a case in medical record department Hospital Wanita dan Kanak-Kanak Sabah. For introduction of the medical record department, Hospital Wanita dan Kanak-Kanak Sabah department has been instrumental in ensuring the systematic management and maintenance of patient record since its establishment in 2005. From the very beginning, the department has played a significant role in improving healthcare service. Its primary focus has been maintaining accuracy and accessibility of medical records, which are essential for the efficient healthcare delivery and continuity of care. In early 2017, a significant milestone was achieved with the implementation of the CASMIC system in a collaboration with the Strategic Medical Record Program under the Malaysia Health Data Warehouse Initiative. The system has enhanced data management process, ensuring efficiency and accuracy in organize and analyze hospital records. Currently, the department consists of 19 staff members, including one head of departments, 5 assistant medicals, and 13 clerks. The CASMIC system transformed the way medical data was managed. It categorized patients into groups based on a similar clinical condition and resource usage. This system has provided the hospital with tools to analyze healthcare delivery patterns, optimize resource allocation, and improve financial management. It has helped standardize and streamline medical record keeping process, then allowing the hospital to align with international best practice in healthcare management. However, challenges arise when this knowledge transfer is not documented. When staff are rotated to another departments, the incoming personnel often start from scratch, creating inefficiency and demotivation. This can lead to reduced responsibility and engagement among junior staff. To address this issue and maintain optimal efficiency, the department must implement robust quality control measures, embrace technology advancement and reporting system, and prioritize ongoing staff training and education to ensure knowledge retention and growth.
So after the introduction of the medical record department in HWKKS, so we're gonna move to the methodology that we are used for this case study. So we are using the qualitative methods whereby we will interview around 5 senior staff members and one of the head of the department, Mr. Chinsuki. So basically in this methodology, we are replicating the study that have been done by Anggun and Budi in 2022, whereby their case study is managing intellectual capital in a public hospital. So they are focusing on the effects on the financial performance. So basically, this is the approach to gather information through the documents and also the staff interview. So by this methodology that used in this case study, especially the medical record department in HWKKS, we are using the data source where the information is collected from the interviewers, and the documented memos also review. Same goes by the reports and also the report of the achievement. So for the data analysis, It's actually based on the collected data, and from that collected data we are interpret how actually the intellectual capital improve the department efficiency and the effectiveness. So interview is accurately reflect by the experience whereby the staff is already try to say approved by their experience in managing this department. So as you can see from here, the slides, this is the qualitative, how the qualitative data is being implemented. So the interview session is held with the 6 senior staff, and the interview is actually based on how well the intellectual capital has been used direct or indirectly during their service, not only in the medical record but also during their service in the other department. But as you can see, there is two groups. One group is more than a 15 years service, and the other group is more than 25 years service. The longest staff that has been work in this field, the medical record department, is Mr. Chinzeki, where he already served in the medical record around 17 years. So we will move to the next slide. So actually, there is a lot of findings that we have discovered from this case study related to medical record department. So in the term of intellectual capital, first finding in the human capital. Actually, the human capital is something value that can be offered by the staff or the worker towards the department itself. It can be the experience or the knowledge or the skills that can enhance the efficiency in that department. So there is five ways, the five findings, the major one. The first one is to enhance the skill through the continuous training. I do believe that all department also using this method to increase the human capital in their department. So from this department, there is a major collaboration between the Intan and also the healthcare minister, whereby there is a continuous course that encouraged by this group for us, the AMRO, assistant medical record officer, to follow the course. So the coding skill, especially in a diagnosed coding skill, is getting better by years. So in 2021, Mr. Chin also encouraged the staff to take the additional skill which can help them in their job description, such as in the counter. The staff counter is encouraged to take the human relation course, and in the statistic subunit they are encouraged to take the Excel course and so on. So the second finding is the underutilization of human skill. So basically, this is quite a negative impact, where it's actually from the internal factor, the attitude and the work culture issue. So some problem might be arise due to the lack of the awareness in the work culture. So this is due to the work culture, but still there is how to say, improvement need to be done in this area. So the third one is the reluctance to share the knowledge. So this is from the interview session, where three from the staff is say that some staff are unwilling to share the knowledge or the experience, so they feel waste to teach those those who show the ignorance or the lack of the interest to the current job. So this is based back to the human skill, the back about the attitude. So the fourth one is the mentoring and emotional intelligence. So this I can see from the senior staff is support the junior staff in improving their skill for those who are willing to improve themselves. So particularly in managing the medical record and also the automation. So the second one is the emotional intelligence for the counter staff, where they also have been improved their emotional intelligence through mentoring from the senior staff. So they already know how to handle this kind of customer, this kind of issue. So there is a less problem arise from repeated problem that had been issued at the counter. So the last one is the positive leadership style, where the culture is to encourage and support the innovation and efficiency in task completion. So whatever it takes, as long as there is no rule that has been break, or there is no harm towards the other staff, you can do anything as long as the job is done. So this is the first finding for the human capitals. Next, we will go to the second findings in structural capital. So basically, in the findings in the structural capital, as you can see from the video that I have shared, there is a 5 major finding also. The first one is the space limitation for storing medical reports. So the case note. So this is difficult to manage medical report and the knowledge effectively. So because of the space is limited, it's very hard for us to fully organize the case note, all the files. So some staff also don't store the journals for the future reference. If the staff is resign or change to the other department, the issue has been arise. It's very hard for the current staff that taking over. So yeah. So the tacit knowledge, the third one is the tacit knowledge is only shared in formally during the break times and when the staff asks. So this is due to the space limitation and how to find the case note, how to trace the case note. So this is basically the tacit knowledge that need to be asked and follow the experienced staff, so they know how and where the tips to find the case note in a limited time. Okay, the second findings in structural capital in medical record is MPIS enhancement and knowledge security. So this is to follow the procedure that related to MPIS system to secure the knowledge. So this system actually is promote the good collaboration between staff and the middle management and also the clinical staff. So when there is one center of the raw data about the about the patient information, it's easily for us and the other department to trace the whereabouts about the patient and also the case note, and the clinical also easy for them to ask the case note to borrow the case note from us. And the third finding is the e-medical record through the MPIS. So this structural capital is you can see here, this is reducing the number of the physical case note. So basically, the major issue in the hospital ICAS is the storage for the patient case note. So we have been saw around 1.3 million case note, and the number of the case note is getting increased by years. So by this introduction of the MPIS, there is a lot of improvement for the clinical department and also the medical record department to save the time and budget, and also reduce the time to find the case note. So it contribute to more efficient workplace. The fourth one is the adaptation to the budget cut. So this is by using the available space for the medical record storage. So the statistical subunit using the Obsidian for the knowledge management, whereby all the journal, the workflow. Of course, we have the documentation for the job description, but this one is more, how to say, more simple and easy to be understand by any level of staff. So the last finding for the structural capital is the all storage technologies such as diskette need to be reread to retrieve the all reports. So from 2021, we have been using this to reread back all the data, all the reports, since we asked from the KKM about the all data and there is no response. So basically, thank God, we have been found this all this cat in the store during the reorganization back about the space. So this is helping to improve the department data library, and during this time and back to 2007. Okay, next we will go to the findings of the relational capital. So the third findings in this case study is the findings in the relational capital. So relational capital is basically something that some relationship that has been built and have value on that network. So it can be the internal or the external relationship between between the other department or in the department itself. So basically there is five major findings. The first one is the encouragement to collaborate with clinical staff, since this department very highly associated with the clinical department. So this senior staff is highly encourage the new staff and also the junior to build a good relationship with a clinical staff to improve the collaboration. So this is to help in handling the patient case note from wards to the clinic and also to the medical record. The second findings is also same with the first one, but this one is for the supervisor, the middle managers, building the relationship with the administration department. So when they have a good relationship and reports with other department, if we ask the data or some sort of help in organized hospital data, basically the collaboration between the administration staff is very good. And the third one is the maintaining a good inter and intra department relationship, also same with the others. So senior staff is highly emphasized about this, where if you don't have a good relationship between your own staff and the other staff, chance you are being not helped by them is very high. So the fourth one is the cross-departmental budget support. This is also same, where the head of department secure the budget support from the other department. This is back in 2022 to 2023, where this department asked from pharmacy department to secure the cabin for our storage issue. So since they also asked some help from us, so the rapport between the two department is built. And the last one is how medical record department is supporting the clinical staff. So actually this is not in job description, but since the relationship between the staff, the clinical staff and also the medical record staff is needed, so our head of department is actively encourage us to support the clinical department in helping them to manage the data entry into the SMRP. So that is the finding for the relational capital. So this is the strength analysis that have been made for this department. So the strength analysis, the greatest strength I can say for this department in term of intellectual capital, there is two. First one is the human capital and the second one is relational capital. The first one is the leadership role in the critical events, whereby during the critical events, the ability of the leader, they can redirect and refocus on the main issue, and they are effectively utilize the staff skill and experience in handling the problem. Example, during the task force for the main storage in the hospital, transfer to the Wismana, there is around 1.3 million case note that need to be relocated during 2023. So by that time, with a limited human force and also with a limited budget, the leadership between the medical record department and also with the help from the hospital director, so they managed to transfer all the 1.3 million case note within 1.5 months. So the storage in the hospital can be used as new ward to support the increase of the patient in pediatric discipline. So the second one is the appreciation from the upper management. So this is actually to cultivate the positive work culture and motivate the staff. The second strength is the relational capital. So they are very highly encouraged to building a good relationship between the overtime staff and also the clinical staff. So when they have a good relationship, they will gain the good collaboration. So the second collaboration is from the health department of state from the Negeri Sabah. So we are major data provider for the Sabah in term of the women and the pediatric health information. So when the strong relationship between this department, between the JKNS and also the hospital ICAS, there is provide the significant advantage. So during the my step implementation, the new staff, basically we got 5 my step staff to be relocated into our department instead of the other department, since the relation is good and with the good justification, so we can get the extra 5 staff to support the current workload in the medical record. So we will go to the analysis about the challenges. So here in the analysis for the challenges, so this is very main issue in this hospital actually. So the first is the structural capital. So there is a limited budget and also limited space, and it's also becoming the staff is also shortage in the staffing. So this is very some of the major issue that we have been faced since 2016 until now. So we are struggle with a limited space for storing the patient case notes, and when we get the new storage, only in 1 year it's already reached the full capacity. So this contribute to the inadequate documentation from the space storage. So basically during the relocation from the main storage in the Hospitalikas to the Wismana, some of the main documentation is missing. So the inadequate documentation from the previous management also contribute towards the challenges that we have been faced. So we need to rebuild back, to restructure the workflow and also redocument all the data, since the hospital has been established from the 2002 from 2005. And the second challenge is the human capital, where actually there is a lack of skilled staff, and the knowledge transmission is taking time, whereby there is a lot of factor, but the factor that we can see here is the new staff is lack of interest in the learning, maybe because of the environment is not so conducive for them, and mentoring session is becoming so difficult. And then the growth mindset among the staff becoming the challenges, and this is widening the skill gap between the senior staff and also the junior staff. For those who are willing to learn, it's okay, but for those who are not willing to learn, it's very challenging for this department to operate more efficiently. And the last one is the challenges in the human capital is we need to define the set of skill that needed for the staff that appointed in this department, so they know clearly what they need to be and what they need to done, and how to do the task efficiently, and to make the how to say, to make the skill gap becoming smaller. So everybody have the good skill in managing the medical record department, especially in the subunit. So wherever the staff is relocate or absence, so the other staff can manage well the issue that arise from that situation. And we will go to the next slides. Okay, this is the analysis for the major improvement that we can say from the intellectual capital in medical record department. There is basically there is a two. So the first one is the human capital, especially for the work culture. So we can encourage to learn and having improvement among the staff to build the work culture to have have how to say have willingness towards learning the new skills. And the management can refocus. The second one is management can refocus to solving a critical issue instead of focusing on the stuff that has been made a mistake. So basically this is for the middle manager, for the supervisor, where instead of blaming the staff for doing not good tasks, the the supervisor can ask them or can teach them how to do the work efficiently instead of focusing on the attitude. So by this I do believe, and the senior staff also believe, that this can improve the work culture itself. So the third one is the memo and the workflow need to be documented to for future staff reference. So for me, I have been go through this situation whereby we don't have any kind of data that can reflect the true workload in the clinical department. So we need to check back all the diskette, and also need to recheck back all the documentation that related to the issue. So what we have been found, that the memo and the workflow is not well documented. So this is the very biggest challenges towards us. And yeah, I think this is the improvement that this department need to be done. And for the structural capital, for the knowledge retention, there is also three. The first one is the knowledge retention, so becoming active since 2022. So I hope this work culture and also this process is continued by the future staff and also the current staff. And the second one is the Google Drive is becoming the source of the knowledge information regarding any issue. So this is the free sources and easily to be reached in any department. So this is the major improvement that we can say for this department. And the last one is this department is becoming a lead and reference to the new hospital, the hospital UMS, in their medical record department. So basically this is what we have done for the improvement in intellectual capital. So as I can say, the conclusion for the intellectual capital in the medical record department, there is a three conclusion. For the first one is for the current situation, the intellectual capital is implemented but is not standardized. So the staff and the management are not fully aware about the knowledge management and the importance of the knowledge management. So because since there is no enforcement or the policy has been done for the knowledge management itself, the knowledge management in this department is often depend on the individual staff, so which needs to be addressed to ensure the efficiency. So when this kind of stuff is already relocated or transferred to the other department, this department becoming back to the zero. So it's quite hassle and repetitive flow. And the second conclusion for intellectual capital in the medical record department is the challenges in the structural capital. This is a never-ending issue that has been faced since 2015, 2016 until now. And our hospital is already trying to implement the e-medical record to reduce the number of the physical case notes. So we try this new alternative such as the medical program information system, the MPIS system. So this has been implemented from November 2024, and medical record is one of the major team that directly assist in this implementation in a hospital EMR, the e-medical record. And the third one, the third conclusion I can say, is the challenges in the human capital. So it's not easy to encourage the staff to involve in the knowledge management, especially the learning session. So the continuous encouragement between the new staff and the senior staff should be continuously being done. And the new perspective for the staff regarding the intellectual capital is also has been discovered, and they also know, wow, this is the skill that need to be learned and documented, so they can use not only in this department, but when they are moving to the other department, this kind of knowledge they can use so for their work efficiency and work and job satisfaction. So as I can say, the intellectual capital is a very wide, but they are not know this kind of knowledge is actually has been used directly in any management or any department. So I really grateful for having this kind of a case study to be done to my department. So that's all from our group. Thank you very much.